It's funny. The other day I overheard this. It was just a throwaway comment, but it really stuck with me. Someone said, "Oh, they're just being bipolar."
Hmm.
And it got me thinking about how lightly we use these terms,
Right.
these mental health terms, without thinking about their impact.
Yeah.
And that kind of leads us into today's deep dive. We're going to be unraveling this really complex and often misunderstood issue of mental health stigma.
Yeah.
And we have some amazing sources to help us with this. We've got some great articles, one from AHA News, another from the World Health Organization. We've got a really fascinating report from UNICEF Europe and Central Asia, and even a document that's focused on strategies to reduce stigma.
Wow.
So before we get into the specifics of these sources, I think it would be helpful to sort of define what we're talking about here. When we say mental health stigma, what exactly do we mean?
Right.
And our pasted text source defines it as negative attitudes, beliefs, and behaviors towards individuals with mental health conditions. But it's so much more than just a definition, right? It's about real-world consequences.
Absolutely. Yeah, you think about it, like someone who's struggling with anxiety, they might hesitate to even seek help
Yeah.
because they're afraid of being labeled as weak or unstable.
Yeah.
Or a teenager, right, who's
Yeah.
going through depression.
Right.
They might keep all those feelings bottled up
Yeah.
just because they're worried about, being judged or ostracized by their friends.
Right.
So stigma really creates this like invisible barrier.
Yeah.
It prevents people from getting the support they need.
Yeah, it really does. And our sources highlight the impact of the stigma on relationships, employment, even just basic access to healthcare.
Absolutely. And, it's not just about emotional distress either. This stigma, it can have really serious and tangible consequences.
Sorry.
In fact, the pasted text document, they mentioned this really interesting term. It's called diagnostic overshadowing. And it's a chilling example of how stigma can actually have life or death consequences.
Whoa, okay. What is that? I've never heard of that. What is diagnostic overshadowing?
So imagine, right, you're dealing with both a physical health issue,
Okay.
maybe like chronic pain, and also a mental health condition like, let's say, depression.
Okay.
And because of the stigma around mental illness, your doctor might actually attribute your physical symptoms
Oh, wow.
to your mental health condition.
Right.
And this leads to misdiagnosis
Right.
or inadequate treatment for that physical problem.
Wow. So it's like your mental health diagnosis is overshadowing the other health needs that you have.
Yeah, and it just highlights why it's so important to address stigma on all levels.
Yeah.
From, individual attitudes and behaviors to these systemic changes within healthcare, beyond healthcare.
And speaking of that, like the widespread impact of this, the UNICEF report, it really hits us with a sobering statistic right out of the gate.
Yeah.
1 in 7 children aged 10 to 19 experience mental health conditions. That's millions of young people facing these challenges, and often in silence
Right?
because of the fear of the stigma.
Yeah.
It's just heartbreaking.
It really is. And one thing that I found really insightful about this UNICEF report is its focus on the power of language.
Oh, interesting.
It's so easy to overlook how deeply words can wound, how they reinforce negative stereotypes, and really just create barriers to understanding and acceptance.
Absolutely. And they even call out some specific examples of this harmful language. Things like equating mental illness with weakness
Right.
or using really derogatory terms.
Yeah. And we won't repeat those phrases here.
No,
But it is a stark reminder that we really need to be mindful of the language we use.
for sure.
Our words have power.
Absolutely.
And, this leads to one of the report's most compelling calls to action. Adopting this respectful, non-stigmatizing language in all settings, schools, healthcare, even casual conversations. Think about the ripple effect that could have. If each of us just made a conscious effort to choose our words carefully
Right.
and to challenge that stigmatizing language when we hear it,
Yeah,
we could really start to shift that narrative around mental health.
for sure. And, sometimes it takes seeing someone in a position of power being vulnerable
Right?
to really drive that message home. And that's what I found so powerful about the AHA News piece. They feature the story of Daryl Toll. He's a former CEO of Advent Health Central Florida.
Okay.
And he really bravely opened up about his own struggles with anxiety.
Now that's leadership.
Yeah.
Someone in his position choosing to share their personal experience.
Right.
That can have a really profound impact.
Yeah.
It sends this message that it's okay to not be okay.
Yeah.
and that seeking help is a sign of strength, not weakness.
Right.
It challenges that stereotype of the perfect leader, and it opens the door for other people to come forward and share their stories as well.
Yeah. It's almost like he's giving other leaders permission to address mental health
Right.
within their own organizations.
Let's
It's
say.
just incredibly inspiring, and it's a really powerful example of how personal vulnerability can just chip away
Yeah,
at that stigma around mental health.
I agree. And it's not just about these individual actions either, right?
Hmm.
Organizations like the American Hospital Association,
Mhm.
they're taking concrete steps to address this issue. They even have their own podcast
Oh, wow.
dedicated to behavioral health integration,
Mm.
which is a fantastic initiative. It shows that commitment to educating people about mental health, which is just so
Oh,
important
absolutely.
in breaking down those misconceptions
Right.
and just promoting understanding.
It's really encouraging to see those large institutions taking the lead and creating those resources to foster a more inclusive and supportive environment.
It is. But ultimately, it comes back to all of us. We all have a role to play in creating a world where mental health is treated with the same dignity and respect as physical health.
You're absolutely right, and that leads to a question for you, our listener. What is one small step that you can take today to challenge mental health stigma? Maybe it's paying closer attention to the language you use, or correcting a friend who uses a stigmatizing term, or just being more open to listening to someone's struggles without judgment. Every little action counts.
Absolutely.
Yeah.
As we're going through these sources,
Yeah.
it's really striking me how they all point to the power of personal stories.
Yeah.
When it comes to dismantling stigma,
Mm-hmm.
it's like those individual experiences really provide that emotional weight,
Yeah.
that human connection that statistics and definitions just can't capture.
It's true. And, speaking of that, remember earlier when we were talking about the pasted text document?
Yeah.
It actually delves into that concept of personal advocacy.
Mm.
And it shares the stories of two individuals, John and Maria,
Okay.
who bravely used their own experiences with mental illness
Right?
to advocate for change.
Wow.
And we won't go into their personal details here to protect their privacy, but their stories just really highlight the courage it takes
Yeah.
to speak out
Yeah.
and challenge these deeply ingrained societal perceptions.
Absolutely. And it's not just anecdotal evidence either.
Right.
You think about the impact of campaigns like Time to Change in the UK or Bell Let's Talk in Canada.
Mm.
These initiatives, they center around sharing personal stories.
Yeah.
And they've been incredibly successful at raising awareness,
Yeah.
reducing stigma,
Right.
and encouraging people to seek help.
It's amazing how those stories can just resonate with people on such a deep level.
Yeah.
You realize that these mental health challenges, they can touch anyone,
Yeah.
regardless of background, age, or social status. It makes the issue feel real and relatable and less scary.
And that's precisely the point.
Yeah.
It's about breaking down those walls
Right.
of fear and isolation that stigma creates.
Mm.
When people share their stories, it helps others realize that they're not alone, that there's hope, and that recovery is possible.
It's interesting how this connects to that WHO article that we have.
Right.
They actually delve into the scientific evidence behind the power of social contact when it comes to reducing stigma.
Right.
And it perfectly complements what we've been talking about with personal stories.
Absolutely. The research shows that simply interacting with someone who has lived experience with a mental health condition can significantly reduce prejudice and discrimination.
Wow.
It's about putting a face to the illness, challenging those preconceived notions and stereotypes.
Okay, I have to admit, when I was reading this WHO article, I got a bit stuck on this term,
Okay.
experts by experience. Can
Yeah.
you help me unpack that one a little bit? I think
Sure.
it's a really interesting concept.
So experts by experience refers to individuals with lived experience of mental health conditions
Okay.
who use their personal knowledge and insights to advocate for change, to support others, and inform policy decisions.
So they're not just sharing their stories, but they're actively contributing
Exactly.
to the movement to improve mental health services
Yes.
and break down stigma. So
Absolutely.
it's like turning their lived experience into a form of expertise.
Exactly. And this is where organizations like the Global Mental Health Peer Network come in. They empower these individuals
Okay.
to take on leadership roles,
Right.
to become agents of change within their communities.
I love that idea.
Yeah.
It's about recognizing that the people who are closest to the issue often have the most valuable insights
Absolutely.
and perspectives.
And this brings us back to the idea of a multifaceted approach to tackling stigma.
Right.
It's not just about education or policy changes.
Yeah.
It's about creating a culture of empathy,
Right.
understanding,
Right.
and support that values the lived experience of those with mental health conditions.
And that requires action on multiple levels, right?
Absolutely.
Individuals, communities, organizations, policymakers. Yeah.
We all have a role to play.
Precisely. And the pasted text document, it provides a pretty comprehensive roadmap, actually,
Okay.
for how we can achieve this. They outline several key strategies for stigma reduction, starting with education and awareness.
Makes sense.
Right. The more we understand about mental health, the less likely we are to fear it or to judge those who struggle with it.
That's true.
Exactly. This is where initiatives like public awareness campaigns, school programs, and mental health training in the workplace can make a huge difference.
Yep.
It's about normalizing those conversations about mental health,
Right.
breaking down those taboos, and promoting understanding from a young age.
But it's not just about providing information. It's also about changing the way we talk about mental health.
That's a crucial point.
Right.
The pasted text document, it emphasizes the importance of using respectful and non-stigmatizing language. Think about the impact our words can have.
Right.
A simple phrase like man up or just get over it.
Can be incredibly dismissive and hurtful to someone who's struggling.
It's so true.
Right.
We need to be more mindful of the language that we use and just be willing to challenge others when they perpetuate those harmful stereotypes.
And this links back to what the UNICEF report highlighted about the power of language.
Right.
Remember their call to action for adopting respectful language in all settings. It's a reminder that change starts with each of us, in our everyday interactions.
But individual action is just one piece of the puzzle.
Right.
We also need systemic change, right?
Absolutely.
Right.
That's where policy and legislation come in.
Okay.
The pasted text document.
Yeah.
It highlights the importance of advocating for mental health laws that protect individuals from discrimination and ensure equitable access to services.
And those laws aren't just abstract concepts. They have real-world implications.
Yeah.
Think about the Americans with Disabilities Act in the U.S., which prohibits discrimination based on disability, including mental illness.
Right.
This law has helped create a more level playing field in areas like employment, housing, and education.
Exactly. These laws provide a framework for societal change. And they help ensure that the rights of individuals with mental health conditions are protected.
Right.
But advocacy doesn't stop there.
Right.
It's about pushing for increased funding for mental health services, promoting mental health awareness in the workplace, and advocating for policies that prioritize mental well-being.
It sounds like a monumental task, but when you break it down,
Right.
it's about taking small, consistent steps toward creating a more just and equitable society for everyone.
I couldn't agree more.
Yeah.
It's a long-term commitment.
Right.
And it requires that ongoing effort from individuals, organizations, and governments.
Yeah.
But the potential rewards are immense. Imagine a world where people feel comfortable seeking help for their mental health without fear of judgment or discrimination. A world where mental health is treated with the same importance and urgency as physical health.
That's a world worth fighting for, isn't it?
Absolutely. And the resources we've explored today, they give us a roadmap, a set of tools, and a sense of hope that this vision is possible. They remind us that we're not alone in this fight, that there's a growing movement of individuals and organizations dedicated to dismantling stigma and creating a more inclusive and supportive world for everyone.
Wow, we've really covered a lot of ground, haven't we? From casual comments to global campaigns, scientific research, personal stories of incredible courage and resilience. It's been a journey. So as we start to wrap things up, I want to turn to you, our listener. What's resonated most with you?
I think for me, it's just the sheer scope of this problem. I mean, we've seen how stigma manifests in so many ways, from subtle microaggressions to outright discrimination. And it impacts individuals, families, communities, even entire healthcare systems.
It really does.
But amidst all the challenges, I think there's also this palpable sense of hope.
You're right. Yeah, it's really easy to get bogged down by just how big this issue is. But these sources, I think they all emphasize that we're not powerless. Each of us can be a part of the change. We can challenge those perceptions and create a more inclusive world.
Absolutely. Whether it's choosing to use respectful language, advocating for mental health awareness at work, supporting an organization like the Global Mental Health Peer Network, just listening with empathy to someone who's struggling.
Hmm.
Every action, no matter how small, can make a difference.
Absolutely. Remember, that pasted text document listed some pretty specific strategies for reducing stigma.
Yeah,
Education and awareness being key, promoting social contact, challenging those discriminatory attitudes and behaviors, even advocating for policy changes and increased funding for mental health services. It's a call to action on every level,
yeah.
individual to systemic.
And that's what makes it so compelling and so multifaceted, right?
Right.
It's not just about changing minds, it's transforming systems,
Mm.
dismantling those barriers that prevent people from getting the care and support they need.
One thing that really stuck with me was that idea of diagnostic overshadowing. It's a chilling reminder of how stigma can have really, really serious consequences.
Yeah.
Makes me wonder, have you ever seen or experienced this, maybe in your own healthcare or with someone you know?
Is a really important question to reflect on. Because awareness, that's the first step to change.
Yeah.
Recognizing how stigma can show up, even for professional settings, can help us be more proactive,
Hmm.
advocating for ourselves and for others.
Absolutely. And sometimes advocacy starts with simply being informed. We've
Right.
mentioned some really fantastic resources, the AHA News website,
Hmm.
the WHO's mental health section, the UNICEF report. These are all really valuable places to start.
Absolutely. Knowledge is power. The
Yeah.
more we understand about mental health, the better equipped we are to challenge those misconceptions, advocate for change, and support the people around us.
So as we wrap up this deep dive, we want to leave you with a challenge, a call to action. We've explored mental health stigma, the consequences, and the different approaches to dismantling it. So what's one tangible step you can take? What can you do in your own life to be a part of the solution?
Maybe commit to using more respectful language. Educate yourself and others about mental health. Support an organization doing this work, or just be more present and compassionate in your interactions with those around you.
Because ultimately, it's about creating a world where everyone feels seen, heard, and supported no matter what. A world where seeking help isn't a sign of weakness, but a step towards well-being.
Hmm.
And that's a world worth striving for, together.